Well, it's 8, so maybe, oh, there's Tiffany, and looks like a few more people coming on. But just to be mindful of everyone's time, certainly thank you for inviting Ashley and I to provide a briefing, a legislative briefing for you on this Thanksgiving weekend. And glad everybody is able to join us here. And for those of you who don't know me, I'm DAV's National Legislative Director, and Ashley is our Deputy National Legislative, or Deputy Communications Director. And both Ashley and I work at our National Service and Legislative Headquarters in Washington, D.C. Although we're working remotely right now, that's where we're headquartered, actually. And just a little bit of background, I think Al or Sandy sent around bios for Ashley and I, but I'm an Army veteran. I've been with DAV now about 25 years. I was trained as a National Service Officer, and I worked as in the field for a short time in Phoenix, and then came up to Washington, D.C. for a National Appeals office and worked there for a couple of years. But the majority of my career has been spent on the legislative staff and covering mainly VA healthcare issues to include post-deployment health issues, VA specialized readjustment programs, mental health services, women veterans issues. So for those of you who don't know Ashley that well, Ashley is a Marine Corps veteran. She was a combat correspondent. She's been with DAV when she was in the military, and she's been with DAV for about 9 years now. And she's doing more and more work with me on women veterans issues, and she's been working with our National Interim Women Veterans Committee this past year. She helped in the production. Her and I worked on both of the reports on women veterans that were done, the first one in 2014 and the second one, The Journey Ahead, in 2018. So we've worked closely together on these issues, and she's also works with Library of Congress, the Veterans History Project, and she's been really promoting the collection of women and minority veteran oral history, for their archives. So, we certainly appreciate her being on staff in terms of the communications, but we're even more excited now that she's working sort of in a hybrid position and working a little bit in legislation, as well as taking on a couple of priority issues on the that legislative team is focused on, including minority and women veterans. And we think this will really, again, help the communications piece of it. Ashley's very involved in the magazines, DAV magazine, and a lot of communications, anything related to communications that DAV is doing. So certainly she brings a lot of expertise to the table in that regard, and helps us with grassroots advocacy and doing outreach. And I think you're just going to see her more and more, and hopefully we're going to have her testifying before Congress soon. As you'll hear from our presentation that we're going to do and run through, women veterans has been a really important issue this entire Congress, the 116th Congress. And a lot of work has been done over the last 2 years. And as this Congress is coming to a close, we're going to share with you sort of where we are, and then a little bit about what we think is going to happen in the future, as well as having time for some question and answer period at the end, so that you'll have an opportunity, all of you, to ask questions about us. But I thought we would just go around as well. And just for the Women Veterans Advisory Committee, Al or Connie, one of you guys sent me the just the names of everybody on the advisory committee there in Wisconsin. And but just to introduce yourself, just your background with in the military, and just a little bit about yourself, if you would start us off, Sandy, that'd be great. Oh, you're on mute.
Can you hear me now?
Yep.
Okay, I'm a Marine Corps vet. I was in from 79 to 82. I didn't do anything illustrious in the service. I was in dispersing, so I was in charge of paying people. I've been with DAV now for about 7 years, and I've been the chair of the Women Veterans Committee. This is my 3rd year now.
Great.
That's me.
Great. Connie?
Hi, I'm Connie. I'm an Army veteran, 6 years, 6 months, 1 day active. I was in military intelligence. I was a Russian linguist when I was in. I've been in the DAV, I don't know, maybe 15 years-ish. And yeah, I'm in a chapter that I'm their service officer, and I'm also the adjutant.
Great. Let's see, Rosalind.
Hi, I'm Rosalind Howard, and I went in active duty. I did active duty for about 4 years, and then I did the rest of my time in reserve, so altogether about 27 years. And I was Army of course. And I've been with the DAV. I started around November of last year, so it's been a little difficult, especially with this year and not being able to get out and really learn what's going on. And I just joined the Women's Committee a few months ago. It seems like a few months ago. I don't know with all this going on, so it's been a few months, but I'm learning a lot. And thank you guys for coming and speaking with us.
Great. Pat?
Hello, everyone. So I'm Pat Lillis. I'm a physician. I was retired Army, total of 32 years active service. I'm in central Wisconsin. I've been with the DAV. I think it's less than a year. I might have to defer to Al, but I've been with the committee for just a couple months, and I'm really happy to be here. And I'm grateful that we have you two meeting with us this evening.
Great. Tiffany?
Hello, good evening. Welcome to Wisconsin. Nice to have Joy and Ashley with us tonight. Always nice to have guests spicing up our women committee. I'm a U.S. Army veteran. I spent 14 years in both the active reserve and National Guard component. I was a behavioral science specialist for my primary MOS. When I first got in, I was a locomotive dispatcher, and they would call us the brains of the trains. But we were the computers of the field. We didn't have any kind of computers back then. And I've been very active in women veterans issues here in Wisconsin. I was a former woman veteran coordinator for our state, and now I am very active with our DAV Chapter 19. Under the leadership of John Polk, he's shown me the ropes. And I love Sandy and the whole committee. So again, thanks.
Great. Well, everybody knows Al. Al or John, do you guys want to say a few words?
Well, you know me, Joy. I never met a microphone I didn't like, so I will say a couple words here. Pat's been a member. Pat, you're going on your 3rd year now. that you've been a member of Chapter 57
Mhm.
and are very generous in your donations towards our DAV vans and other programs we run. So I want to acknowledge that. I thank both you and Ashley for doing this. I think it's quite important. I know we've worked together, Joy, for the last 5 years plus at least. And I'm sure what you'll say will be very enlightening to all of us. John, your turn.
United States Army, 8 years active, the rest in the reserves. I retired at 20. Infantry armor type person. Been in the DAV since '82. Been active in the DAV for about 12 years. Chapter adjutant. I'm a service officer. I'm a volunteer driver. Also, I'm on the foundation, president of the foundation, and I'm a judge advocate, and I'm the advisor. As a judge advocate, I'm the advisor on the committee.
Okay, great. Ashley, you want to just expound on a little bit on what you did in the military?
Yeah, so I mean, as Joy mentioned, I'm a Marine Corps veteran. I spent about 8 years in. I'm at that weird point now where I've spent more time out and with DAV than I did in the Marine Corps. But I was a combat correspondent. I mostly did broadcast journalism, so I was a news anchor for a while for the Pentagon Channel. I did a lot of traveling around the Pacific, and then did a tour in Afghanistan in 2009, right at the height of the surge, and stood up the news bureau there. So I had a lot of really interesting experiences, came back to the DC area and worked at the Pentagon News Bureau with all the anchors that cover all the Pentagon goings on. And so I've had some interesting times, met a lot of really interesting people throughout my time, but honestly, nothing has been to me as fulfilling as coming and working on behalf of veterans at DAV. So I'm very fortunate to be in the position I am now and work for Dan Clare, as you all know, Rob Lewis, great guys that I'm happy to call my Marine brethren and my bosses. So great folks. I'm glad to be here and certainly glad to be working with Joy and her team a little bit more. I've kind of been on the periphery of legislative issues since I came on board, working in DC. So I've really, to this point, I've gotten deep enough in things that I can explain them in a news article. I can explain them to other people, but now I'm really excited to have a chance that I can start diving in a little bit more, learn from Joy and her team, who are second to none. They're the absolute best in the business. And start, as Joy mentioned, testifying at some point, writing testimony, even, possibly, we just had Shane working on drafting legislation. So that's all interesting, a chance to kind of open up the scope of what I know and what I can do. So I'm still very much so learning, but I couldn't imagine better people to learn from. So Joy, do you want to?
Great.
Go ahead.
Yep. I should have mentioned my time in the Army was 1982 to 1985, and I spent, I was a medic, and I worked as a medic and EMT in the emergency room at the 67th EVAC. I spent almost all of my time there in Würzburg, Germany. So always worked in healthcare before I came in the military, during the military, and then when I joined DAV, somehow ended up back doing healthcare, so covering healthcare issues. So I guess that's just meant to be. Ashley, you want to cue up the PowerPoint for us and maybe start us off?
Yeah, I'll get us going. Okay. And okay.
And we'll send you guys the copy too of the PowerPoint following the meeting, so you have that as well.
And I have hit the record button again, so I'll just go ahead and splice together the first part and then where I dropped off and made my re-entrance. So we'll have all that recorded and ready to share. Okay, so As many of you, I'm sure, know, DAV has for decades now been involved in, advocating for women veterans and working specific women veterans issues. Excuse me, get that out of the way. And as Joy had mentioned earlier, in 2014, we worked in producing and promoting DAV's first Women Veterans Report, Women Veterans: The Long Journey Home. And that report was largely focused on transition from the military into civilian life, and the gaps that existed in programs and policies concerning healthcare, benefits, disability compensation, transition support, employment, housing, things like that, and gave 27 recommendations that could help drive action and change regarding those issues. And we were very, very pleased with the initial reception of the report. It was actually on September 24th of 2014. It was my birthday. We had our Lunch and Learn event, and it was very well received. It's still gotten pickup years later. People still reference that material. Really, we were also very pleased with the progress that was made following its release. Certainly a lot more to do, but initially, there was legislative action and as well as changes that were made by the agencies that were mentioned in those recommendations that were made from the report. So all very good stuff. In 2018, just 4 very quick years later, that felt like no time at all, we felt that it was time for that second report, for that follow-up, and that came out as Women Veterans: The Journey Ahead. And again, that was in 2018, and that included 45 recommendations to further improve VA healthcare and specialized services for women veterans across all generations of women veterans. So both of those reports really bolstered DAV's inclusion of women veterans issues in our annual list of critical policy goals, working to do things like achieve equitable access to comprehensive healthcare services and benefits for women veterans. I guess I can go back one slide, sorry. To ensure the availability of gender-specific care and programs for women, to focus on the environment of care issues, things like the safety, privacy, and the culture within VA healthcare settings, to address barriers for care for women veterans, whether it's something like you don't have childcare, whether it's even just feeling unsafe at a VA facility, maybe due to a past trauma. Also to usher in change to VA culture, kind of mentioned that a little bit before, and really to work to end harassment in VA facilities, because those numbers are still, alarmingly high, as well as to just normalize the recognition of the contributions that women have made in military service. So those are pretty lofty goals, but Joy's team has been very persistent, and we've been fortunate that these issues have been given a lot of much needed attention in the 116th Congress. So here's a kind of a breakdown of what we saw throughout 2019. These are a list of hearings that DAV either testified at or gave statements for the record before the House and Senate Veterans Affairs Committee. As you can see, clearly Joy has been very busy, as well as her team. Kind of just running through, female veterans' access to VA services, cultural barriers, as I mentioned, affecting women's access to healthcare, ensuring access to disability benefits for survivors. I'm sorry, I only get part of my screen here. And the list goes on. And then the hearing mentioned at the bottom here in September, that was a legislative hearing that Joy testified at that actually included 12 women veterans bills, which included things like the Newborn Care Improvement Act, a bill that would require a report on the availability of prosthetics for women veterans Healthcare Accountability Act, the Breaking Barriers for Women Veterans Act, the Caring for Our Women Veterans Act, and several more. that momentum continued on into 2020, although COVID has certainly put a bit of a damper on the number of hearings that were able to be held. But you can still see that there were a fair number of hearings covering a broad swath of women veterans issues. Looking at military sexual trauma, mental health care for women veterans, reproductive health care, which of course is a big one, not just for women veterans, but for all veterans who've had wartime injuries specifically. Ending sexual harassment within the VA. And then at the end here, you can see the reauthorization of the Women Veterans Task Force. So in February of 2019, hold on, I'll get to this a little bit more in just a second. The House Veterans Affairs Committee Chairman Mark Takano had established a bipartisan Women Veterans Task Force to increase the visibility of the 2 million plus women veterans living in the United States, and as a way to promote inclusivity and equitable access to those resources and benefits and healthcare for women veterans. It was launched the following May and is chaired by Congresswoman Julia Brownley. The task force, since it's been stood up, has held a number of roundtable discussions addressing things like interdisciplinary research regarding women veterans, as well as military sexual trauma within the military and veterans community. And then, as I mentioned in the previous slide, there was a hearing in this past September to reauthorize that task force. The VA has also established a Women Veterans Task Force that was back in 2019 as well, which DAV has representation on, and Joy may have a little bit more to mention about that task force. But lastly, to close out the year on December 3rd, and this goes back to the slide that I previously mentioned or previously showed. So this coming Thursday, actually, Joy is going to be testifying at a hearing to review the VA Women Veterans Advisory Committee recommendations from 2020. So that's something that we can all look forward to taking a look at. And then once that's done, then maybe Joy will actually get a little bit of time off for the holidays. We'll see. We'll see if they don't pull something else out of their hat for Joy to tackle before the year is out. But Joy, I think you want me to head to the next one. I think we'll move on to you here.
Yeah, I just, I think Ashley's given a good, setting there, sort of where we're at. And I think, just to highlight on the Women Veterans reports, they're really made up of VA research. One of the things that we were really pleased about over the last, 5 to 7 years is that VA made a real effort to increase the number of research projects that they were doing on women veterans, and that sort of coincided with, the wars in Iraq and Afghanistan and women veterans, more and more women serving in the military. And we were so pleased that the researchers took advantage of that right away as women really started to come into the VA healthcare system in significant numbers. We saw tremendous growth, almost, tripling over a short period of time. But VA still, overall, with its 9 million enrolled patients and 8 million, users of the system, right now women make up about 500,000 women veterans throughout the healthcare system. So you see, and then you spread those women across the entire, United States. You see that there's still a minority within the population. And one thing that we found was we really needed to make sure that we highlight, the unique needs that were coming out, that we were hearing about as women were returning from Iraq and Afghanistan, talking about their experience, their transition experience. And there were several films that VA was involved in, that DAV was involved in that, we were contacted by filmmakers who were talking about the experience of women serving in Iraq and Afghanistan. And they did some really important work, which is to follow women following their military service during that really critical 5-year, transition period when they got out. And we started to see, based on that, and as well as the research that was being done, that they had some a different military experience often than their male counterparts in terms of the transition, in terms of coming home. They just had different roles in society and returning to their homes as working mothers and coming back to their children often that they had to leave that were very small, family dynamics, coming into the VA healthcare system for the first time. So I think our reports, the thing we were most proud of is that they were really observed by not only members of Congress, took a lot of the legislative efforts, and legislation has come directly from our reports and the recommendations that we made. So we took the VA research that was done and just, tried to make recommendations where we saw there were gaps in different programs and services that women were telling us just weren't meeting their needs. The legislation that really came forth during this Congress, they were introduced as those collection of individual bills. So probably we have about 15 or 16 bills that were introduced on women veterans, and they were coalesced into the Deborah Sampson Act. And first it was introduced in the Senate S 514, and then the House Veterans Affairs Committee held a series of hearings on all of their women veterans legislation that was introduced. And as Ashley mentioned, Chairwoman of the Health Veterans Affairs Subcommittee on Health, Julia Brownlee from California, she headed up this task force of congressional members who also decided to really focus on women veterans for the entire 116th Congress. And they held a series of roundtables and these legislative hearings. I mean, it was lucky if we were getting, one hearing on women veterans every 2 years, alternating between the House and Senate. Despite our, request and pleas for hearings, that's at the discretion of the chairman and chairpersons of those subcommittees. So I think this has really been a banner year in terms of people just getting, being more aware about women veterans. I mean, I think DAV's been working on this issue, as have a number of our VSO partners and other organizations. But, we started to really see this traction start to take hold. And so we were pleased that the Deborah Sampson Act, it was a very comprehensive piece of legislation that included about 12 or 13 separate provisions from bills that were introduced individually. And then they were, collated and combined into the Deborah Sampson Act, and that did pass the House. Next slide, please. So some of the bills, as I mentioned, the individual bills that make up the Deborah Sampson Act in both the House and Senate, did talk about or did include some things that we've been working on for several years. So the VA Newborn Emergency Transportation Act really talked about, aimed at legislation that when a mother, after the delivery of a newborn, there was a gap in the statute that did not allow for them to do any transportation of that infant to a facility if they needed specialized newborn care. So that was an important issue, and that really needs to be taken care of. Women veterans were getting really incredibly large bills, if they had an infant that needed to go to a neonatal specialty, location. The Child Care Act, probably something that for you guys that have been around have heard about. One of the barriers to care that's often identified for women is they're often the primary caretaker of children. And for those that need, let's say they're going through some intensive treatment for PTSD, mental health services, that's just not appropriate for them to bring their children with them to those visits, but having to go, more frequently, childcare became sort of a barrier to getting the care that they needed. So I think some of the changes with the pandemic have helped now that really opened up telehealth opportunities for that may help a little bit with childcare, but still, some are needing that service when they're trying to get needed care. Next slide, please. Prosthetic items for women veterans. So this was something, we heard about early on from women, was that, it's sort of the first time, and when we think of prosthetic items in VA can be any sort of item that provides some sort of assistance to the person, and not necessarily just a prosthetic limb or arm. But certainly that was one of the issues that we saw. We did have women with limb loss due to catastrophic injuries in Iraq and Afghanistan. And again, VA was really making prosthetics for male veterans primarily. So women coming in to the VA and had a host of different issues dealing with prosthetic items, especially during pregnancy, where they had weight gain and then weight loss, having their limbs, fitted properly for them, and numerous issues just related to items that VA was really just ordering that were male, for men in larger sizes. And for a long time, it was difficult to, women would go needing some sort of care and they would get some sort of item or VA had difficulty getting it because it didn't fit properly. Some of you may know Brenda, I'm trying to think of her last name, just blanked on that. But anyway, they had given her a very large foot. She had an amputation below the knee, did well with her prosthetic leg, but they had a foot that was, too large, and it was not the same size as her foot for her other shoe. And so she was having to buy 2 pairs of shoes for everything that she needed. And, they were having difficulty getting, again, a properly fitting foot that fit onto her prosthetic limb. So there were just a host of these types of things that were coming up, as well as legal services. So oftentimes women veterans were in need of, we had higher rates of homelessness among women. We had higher rates of suicide for women veterans compared to civilian peers. And a lot of these homelessness and suicide and mental health related issues they found from not having access to legal services. So being able to perhaps get help with getting child support that was due to them, or other, legal matters that were preventing them from, progressing in their transition. Not in here, but homeless is one other issue. Homeless programs that, early on we really had, talked to VA about. We said oftentimes women come with their children to VA and are having homeless, or on the verge of being homeless, or fleeing from domestic violence situation. And while VA could care for the veteran, woman veteran, they weren't able to place them with their children, which was a major barrier for them and many women opted not to take advantage of those services that they really needed. So VA partnered with the community and worked with different shelters that did have, you know, could keep women together, their children together with the woman veteran, and then be able to utilize all of the great homeless program services that VA does have to offer, you know, for, again, you know, getting back on their feet, taking care of their health care issues, legal issues, and also having this access to some child care services so that they can take advantage of those programs. So HR 3224, the House version of the Deborah Sampson Act, was much broader, and they brought in, probably most of you are aware about the issues that came up last year regarding sexual assault and women, some research that came out which sort of really, you know, made it clear that women veterans were reporting a significant amount of harassment. 1 in 4 women veterans that were seeking care at a VA facility were reporting that they felt that they were harassed in some way or had experienced some sort of sexual, you know, whether that be catcalls, feeling uncomfortable, not feeling safe, seeking care, and reporting that it also became sort of a barrier to care for them, that they just didn't want to go back, even though they liked their VA provider, they liked the care that they were getting, but they didn't feel safe, and they felt the culture really needed to change. And that's where VA did listen, at least in terms of they felt they wanted to get a task force together internally, which was headed up by a collection of service lines within the Department of Veterans Affairs. And Patty Hayes, she's the director of the Women's Health Services Program in VA, and she was instrumental in really trying to tackle this in the larger VA issue that, you know, VA really needs to pay attention to this. They need to have feedback from women veterans, and they need to have their experience office work with women veterans to find out what issues really, you know, in the culture, in the big culture sense, need to be addressed to make women and minority veterans feel comfortable. Next slide. So within the these number of bills, there was also added into the big Deborah Sampson Act in the House were these provisions that included, you know, very specific issues to address sexual harassment in facilities, as well as, you know, training for VA staff to make sure that they felt comfortable working to try to address it, you know, facility-wide, and that everybody would be playing a role in making sure that the VA would be a safe and welcoming environment. There are also provisions in there regarding, you know, domestic violence for women veterans, and, you know, just really improving the oversight of women veterans and preventative health issues that women were dealing with. So the bill is very comprehensive, one of the most comprehensive bills I've seen over my time. And so we're really pleased, again, that many of these provisions really came, the genesis was DAV's report, and that we've had an opportunity to play a greater role in really shaping some of this legislation and making sure that it got introduced. So next slide is, you know, where we are now. And again, this bill, if enacted, you know, would establish the Office of Women's Health, put it up a little bit in the standing of, you know, who Patty Hayes, the director of the Women's Health Program, who she would report to, making sure that just gives them a little bit of more clout over their budget needs, and a little bit more attention So training of health providers in VA is a really big issue. Patty Hayes directs that training program, which is called a mini residency program for providers, women's health providers, and they actually go through specific training because many of them just don't see enough women in their, in their clinics that they've been in to really be proficient in women's health. So it also requires VA, as I mentioned, to really assess the availability of gender-specific prosthetic items to make sure that women veterans can just as easily get any sort of, prosthetic item that they need, and they're going to have it available in the appropriate size for them. Retrofitting, a report on retrofitting VA facilities. So this has sort of been a long-standing issue, and while some of it has been addressed, many of the VA facilities, have just, again, they were seeing primarily male veterans, but the women veterans started to come to VA in record numbers, which really required them to have additional space. And there's very specific policies that VA has in place for those women's clinics, and that space just was not allowing them to have their exam room set up the way that, they knew was appropriate to maintain safety, modesty, and privacy for women who are in for their appointments. We also were instrumental, DAV, in continuing to push for the permanently authorizing these counseling retreat settings. Women veterans told us early on that one thing that they really found difficult when they got out of the military was that they didn't feel they had the same network as male veterans who often, lived near one another or went back and still maintained a relationship where they, came their home area. But women, often fewer women in those deployment, especially of the National Guard. And they said when they came home, they just didn't have that network and support system that they needed from other women. And so these retreat settings really offered a unique location where they could go. They've been attached. VA picked it up. The VA Vet Center program picked it up, and we got such excellent feedback from them that they were doing Boulder Crest. You may have heard of that one. DAV partnered with them, and they've done some specific retreats for women veterans. And those women that attended those said, I've made friends for life, and I've got another, 5 or 6 women now that I'm really connected with. We've went through this program together, and we're dealing with many of the same issues, and they try to match them up so that they can have that beneficial experience. Next slide. So the House did pass late in 2019, HR 3224, the Deborah Sampson Act. Then the Senate went ahead and they marked it up in January of this year, their bill, which was a little bit different. But what they did when they marked it up was they included many of the provisions from the more extensive House version of the bill. And those amendments were approved, and now it's been sitting in the Senate there waiting for action. Since they've married up, the 2 bills now have the same provisions in them. But, and we've heard, good bipartisan support, and we keep being told that they're going to pass this before the end of the year, but we're running out of time. We're just approaching December here. It's a very short window till the end of the year and the end of this Congress. And if this legislation doesn't pass for some reason, then all these bills have to be reintroduced, and we start all over again in the next Congress. And we've really put in 2 years of good work on this with all of these hearings, the support of the VSO community, like I said, bipartisan support both in the House and Senate on both sides of the aisle. So we're just hope, fingers crossed, we're getting the same message from everyone that they intend to move this in a legislative package before the end of the year, before the, adjournment of the 116th Congress. Should we get any other type of word that there's some sort of flare up or something's happened, we will be calling on everyone to, contact their members of Congress to really put the pressure on to make sure this gets taken care of. I mean, I think it's been, fully vetted and everything, the work that's gone into it, it's ready to move. So I don't anticipate a problem, but I hope everybody will stay tuned and make sure that you pay attention, that you're signed up for the Commanders Action Network. That's where we send out our alerts to you if we need, to quickly get a grass action, activity underway, calling, sending emails or doing something specific. But it's not unusual that, Congress does hold things sort of till the end of the year. They wrap up a larger, what they call an omnibus bill. It might have the Deborah Sampson Act provisions plus other outstanding legislation that they want to see enacted before the end of the year. So, I think it's still all positive. Was that our last slide, Ashley? Yep. So, we wanted to take a little bit of time just to do for questions and let you ask other questions either about the legislative presentation or the legislation itself, or I know, when Sandy had reached out, everybody's sort of dealing with how do we work in this virtual environment. And so, I did pass on some tips where, we've all had to adjust as well. We're doing our hearings virtually. We talk to our, members of Congress and our contacts, their staff, regularly over Zoom. So again, these types of platforms, afford you to keep in contact with people. I think making sure you have a good connection with the Women Veterans Program Manager in your VA there, it would be good. So in case they get anyone that needs, some assistance from DAV for claims work, or if there's some other issue that, they're just looking for, a network of women veterans who are, addressing issues and trying to, keep relevant issues at the forefront during this period. And we know for a lot of people are having to self-isolate due to the pandemic. And we know that there's always a concern about domestic violence issues and or personal violence for some veterans, or still dealing with not having stable housing or food insecurity. And so I think those are all things, just as a community that you guys can try to, put out, whether that's on social media, and you're willing to say, hey, we're here, here's some contact information, please feel free to reach out to us if you're struggling and just need someone to talk to, or need some help with claims issues. So I think those are all important, and to really kind of keep an eye on everybody during this time. Everybody reacts differently to, what's happening. A lot of people have had personal losses due to the virus, and also just the politics of the moment, and the just finishing up on a very heated presidential race, and still a lot of strife out there, and people are feeling unsettled. So I think for women veterans, they would appreciate just having the opportunity to just be able to talk with other women veterans, or some of them have come up with their own programs, or other people there, other women they're helping as well. So I think if you just keep an open mind that, hey, let's turn this into an opportunity to also watch out and see if there's any needs that, we can help somebody else with. But I'll open it up, and Sandy, I don't know if you have anything specific, or anybody else, any other members that, you have questions of Ashley and I.
No, first let me say we appreciate you being on here from the bottom of our hearts. Taking the time to sit down with the Wisconsin committee means a lot to us, Joy and Ashley. So let me leave it at that, and I'm going to let the other committee members ask the questions for you guys right now.
Sure. Anybody else? Brave?
Yes, this is Rosalind. I had a question. In one of the slides, you mentioned something about an Office of Women's Health. What kind of office, what would that office do? Is it a centralized office in one location? Would every VA have it? What is the purpose of the Office of Women's Health?
Right. So I think that, the idea there, again, at central office, VA has an office that, there's a reporting structure. And so you want to be able to report at the highest level possible to your Undersecretary for Health or your executive in charge now, and to the VA secretary. But we also saw that, yes, if there's truly an Office of Women's Health, I think we would like to see the expansion of that office. Patty Hayes, Dr. Patty Hayes, to me, has been a real champion. She's since she's come on the scene, we've seen tremendous progress, but she uses the research that VA has, but you have to have people that are able to evaluate all of that raw data and make projections for, demand for services, and where there are gaps in services. And there's just lots of problems with, each facility has some of them have a women's veterans clinic, others don't, and it does depend on the size of the VA, and it depends on how much support they get from their leadership at the VISN level as well as the facility level. And with an Office of Women's Health, they would have a little bit more direct ability over those women veterans who also then, at that facility level would be in charge of that women's health program. Right now, it's more, again, within the facility level, about that, the size of their program, and a lot of the things that they are able to do or are not able to do, is dependent on that. So trying to have a hub and spoke sort of office, we think would be more beneficial, and a little bit more attention. Just to give you one example of that, so the money that goes through VERA, which is the Veterans allocation system for how they distribute money, that goes through the VISN level and down to the facilities. And for women's health programs in VA, that money is often just given for primary care, and they're part of primary care. And one thing that we've seen over and over is that there wasn't any dedicated funding to fix the problems, for retrofitting the facilities, for hiring the number of providers they needed, for their expanding number of women, that were coming into the facilities. And we were able to get some appropriations money directly provided to central office, where in turn she's distributing that money directly to women's clinics to get these deficiencies, these known deficiencies, taken care of. So if they need a larger space, if they needed additional equipment for, more rooms, for, exam tables and privacy curtains, and, a variety those types of things within a bathroom, or a women's clinic that was a comprehensive clinic where they were able to keep everybody in, women within a clinic that had, all the different types of providers that they would need for their primary and mental health services. So again, these programs have been small. They have to fight for their money and attention. So the office, the goal would to be have them have a little bit more of an ability to control their own budget and take care of the issues that they have, and not have so many other programs to compete with.
Yep.
Pat? Pat?
The first one is, you mentioned the Women's Veteran Program Manager at the VA. So the question is that located in the hospital, or where is that actually located? So that's the first one. But the second question is actually more important, and it has to do with the role of a committee such as ours in our relationship to you. And I'm also thinking of parallel committees in other states, let's say, Minnesota or Illinois or, Michigan, in terms of what they are doing, or how we are helpful. And that is part of our job helpful to, let's say, kind of check on whether these programs are happening in the VA. So for example, like you were saying, the clinic. So I know from where I lived before that sometimes at the local level down at the VA, some of the people that work there, they don't know that this money has been allocated for them and that they should be getting this to establish that, because, bigger people up the food chain, they just sort of, that money just, like you said, went off.
Right. Yep. Yep.
Hey, this is something you asked for. Is it to let you know that, hey, the Deborah Sampson Act, let's say it's passed, says, this and this and this should be happening, but it's not happening, or so it's kind of like our job on the bigger level,
right,
sort of thing.
Okay, so you brought up a couple of issues. So one, on the Women Veteran Program Manager, I think it's always really important. VA is supposed to have a full-time Women Veteran Program Manager at each VA medical facility. Now, we know oftentimes that is just not enough based on when you live in a larger urban area, because they take on the role of really making sure that their women's health clinics are staffed, and they also manage women veterans complaints that come in, or women veterans issues that crop up. Somebody who is having a problem getting the care that they need. But there is a whole handbook that they follow in terms of the Women Veteran Program Manager. They're really supposed to be that advocate and the umbrella at that facility, who we hope interfaces with their direct leadership, the director of the facility, and is also looking at the community-based outpatient clinics. And oftentimes there will be, again, this all just depends on the size of the facility and the community-based outpatient clinics, but VA's goal is that your primary women's health provider is going to be able to not only do your, should be able to do your primary care and your gender-specific care all together. And those that have larger women's health clinics where they've got a comprehensive clinic and a PAC team or patient-aligned care team, they also bring in, their mental health specialist, social worker, more of a complement of people that are surrounding and supporting the women veterans that they're seeing. But this varies so much within each facility. I see the role of DAV women advisory committees sort of equal. So one, you're appointed by your leadership. So first and foremost, you know, by your department leadership, you know, they kind of set the parameters oftentimes for you, what they would like you to do, you know, which is oftentimes advise us on, you know, are there women veteran issues we need to know about? You know, maybe be able to talk in more detail about these legislative issues, so you're following them maybe a little bit closely with your benefits protection team leader. And also, you know, giving them feedback about, you know, women within the department and chapters and things that they're asking for. So that's kind of one arm of it. But I always suggest, you know, number one, if you're users of the VA healthcare system, I always think that's really important, because if you're actually getting care in that facility or one of the surrounding community-based outpatient clinics, you've got some firsthand knowledge of how things are working. Number two, if you don't, you also can work directly with the Women Veteran Program Manager. I always recommend that the advisory committee invite them to one of your meetings and to just talk to them and make sure you've got a contact for them. They should know all the women veterans in the catchment area that they're responsible for. If they have town hall events, you know, you can make sure you're, you know, made aware of that, and that if they've got a list, an email list, or any information that's going out from their women's health program office there, that you're going to be getting it. They often ask for you guys to be eyes and ears for them. So again, if you're actually patients there, or if you hear from other women veterans about, you know, problems at the facility, problems with a provider, and also if you have a woman veteran that shows up that's really needing some specialized services, you want to have that contact information and know that you can get a hold of that Women Veterans Program Manager day or night. You know, if you've got a homeless woman veteran or a woman veteran that's in real, you know, in crisis or having a real problem.
So that office, are you saying that office then has a listing of all the women veterans in this catchment area?
They should, well, for the VA, who they have, you know, who's seen at VA, I should say. Now, they might have beyond that, because what VA does is they work with DOD and they send out letters when they get information from DOD, when they have new veterans who are coming back and just getting out of the military. So they often send letters, not only to the women veterans, but male veterans that have now are supposed to, you know, come back home there to say, here's the VA that's nearest to you, here's the programs and services. And often for the women veterans, they send, you know, their brochures that list all the services that, you know, VA provides for women veterans, you know, from, you know, infertility issues to, you know, all of their primary care, specialized care. So, you know, a lot of women, as we know, don't often, I think this is getting less, but we still find it's true that women don't identify as a veteran oftentimes, or think that they're eligible for VA care. Mm-hmm. And as you know, with DAV, you want to make sure you educate them about, you know, that yes, you know, you may be eligible. Let's help you get, you know, get up there, you know, register to enroll in VA. You know, you never know if you may need it, especially these days with people with the pandemic. You lose your job, you lose your health insurance, and having VA as a backup, even when you have other insurance, is good. And there are many, you know, specialized programs that you just can't get in the community, like for military sexual trauma, which is often, you know, for women veterans, a really important special program that VA, you know, provides treatment for. So I think your role is sort of twofold, really making those connections with the VA, even if you don't use it, so that you guys have contact information and they can use you as a resource and you can use them as a resource.
Thank you.
Yep. Tiffany?
Yeah, Pat, I will send you or to Connie the link to how to tap, your woman veteran program manager at your VA. There's a list of them online. But first of all, thanks for your presentation, Joy and Ashley. I have a couple thoughts and questions. Starting off, Al LaBelle does a great job here. I'm so happy. I met him a few years ago, and between him and John Polk, two fellas, and the reports that you guys put out on women veterans, I decided to become a life member because out of, any of the VSOs that are out there, I always tell people DAV is like light years ahead for women veteran issues, and I really appreciate it. But I wanted to know, I'm sure Al LaBelle probably knows this, out of our Wisconsin delegation, as far as the Deborah Sampson Act, who did they all sign on, and how are our senators doing? Did Baldwin and Johnson sign on?
I guess I need to answer this. Senator Baldwin has supported it, the Senate bill. It's S-514. Senator Johnson did not. The House members, I don't know off the top of my head. I can send it to the Women's Committee. Okay. I believe there were quite a few, but not all. So I don't want to get the names wrong. But I will forward to the committee who is supporting the House version of the Deborah Sampson Act. Okay. And thank you for the kind words, by the way.
Yeah. Okay. I only have three things. My second thing is, I noticed one of the policies was, to stop end harassment and assault within the VA. The VA already has policies in place. Would this be to do something different than what because that's not tolerated anywhere. But what was the issue that brought up, official piece of legislation?
So unfortunately, at the DC Medical Center, one of the staff person that works directly for this task force, a woman veteran herself, was out at the VA, uses the VA, went out there and was assaulted while she was waiting in line, getting a cup of coffee. And when she reported, what happened to her, they just sort of froze and didn't know what to do. I think she reported it to, it was near the front lobby area. And when she went in for her appointment, she told the doctor about what happened, and the doctor immediately called the VA police, to file the complaint, And that's the important thing, was I think that while the policies are in place, this happened along with the research that came out, where they had found that 1 in 4 women veterans who was using VA was reporting that they had been harassed in some way or did not feel safe getting care at VA. And so I think it was just to redouble the efforts on making sure that they're, because then when Congress tried to really investigate this, what they found was just there was a lot of lapses in terms of the reporting up, for all the facilities, and to have consistent policies in place, what to do if somebody tells you they've just been assaulted, and then the reporting structure so they can really get an idea of what the level of, these incidents are. And they're also doing right now a bystander training for employees, where if you see somebody being harassed or something happening, how can you comfortably either get somebody to help intervene or intervene yourself? Because these things are often people feel uncomfortable or threatened themselves. They're not sure what to do. So there were just a series of things wrapping around, I think, what VA is already doing, what policies they have in place, just to make them more consistent, and to elevate it, to really make it a safe and welcoming environment for all veterans, no matter who you are coming in.
And on that bystander training, Joy, I know before they implemented it, they had done a study where they did sort of a test case with a certain number of VA staff, kind of looking at how they felt and acted before going to the bystander training, and then how they felt and acted after. And it significantly increased their ability to not only recognize when something should be reported, but to actually follow through and report something on the back end. And so I know they just rolled that out. I got the email this past week, or maybe the week before, I think, talking about implementing that training now. So from all
really, that's a great point, as well as making sure that the facility directors are responsible. You know, they need to have people out front if they have a problem where women are saying, hey, I have to walk through a gauntlet of people, you know, making inappropriate comments, sexual comments. And they've also done an entire, you know, where they're doing videos, what really constitutes, you know, so that people are made aware that, hey, you think you're giving this person a compliment. It's not, it's harassment. Please don't do it, you know. And that also we need everybody that's at the facility, all of our veterans, to play a part in this. If they see something, say something. Don't let someone be harassed, because, you know, that may be the person that needs the VA the most, but they're going to turn around, go back, and never come back.
Right. And I just had one final question. What is the DAV's relationship with the Center for Women Veterans?
We have a great relationship with the Center for Women Veterans. They're sort of the umbrella place. They directly report to the secretary, to the VA secretary. We've worked with them on every women's summit that has been ever taken place. DAV's been a co-sponsor and worked directly with the center. And right now, Jackie Hayes-Bird is the director of that Center for Women Veterans. We meet with her regularly. She has monthly meetings that she does, and she was invited to DAV's conference, our national convention. We've had the directors of VA and the Women's Health Program, so very good relationship with both of those offices.
Great, thank you.
John?
Yeah, I've got just a couple comments. First of all, these two publications that you've been talking about, they're the best publications the DAV has to explain our legislative program. You can't speak highly enough about these two documents. It explains how we identify problems, how we do research, how we publish, how we advocate, how we follow up. You can explain to any audience in 5 minutes how we operate. And although we're not different than other organizations because they're also advocating, but we can show that we are head and shoulders above everybody else by what we do. Have tangible proof. These are the best two documents I think the DAV has that talk about legislation. I want to talk about a little bit the home office. All you have to do is look at the transportation program that we've had since 1987. There's an innumerable amount of decisions are made locally, and every hospital operates differently. Even now during COVID, some are driving, some aren't. Some want to put dividers in the vans, some don't. It's just all different. So it's nice to have a home office to kind of direct the field force and get some uniformity out there in the way things are implemented. And Brenda Reed was the lady's name that you were trying to think of.
Brenda Reed. I can't believe I can't remember. Blanked out on it.
But you'll see her at a lot of national events and stuff like that, and it's kind of interesting. There's a person that exemplifies what we're talking about because she had that issue, and I never really realized until I talked with her that there was a difference in prosthetics. It never dawned on me that they wouldn't already have those. I
Right.
didn't even realize that was an issue. So,
Well, I felt so bad because, you know, I kept telling her, Brenda, I know you're not shy. You go back in there and you tell them you need to get this fixed. And so she came back and she sent a picture to me when she went in to do that. You know what they did? They sawed off the front of the foot, the prosthetic foot, to make it fit in there. I could have just died, you know, and that just was like set me off on a tear.
Yeah.
But, you know, it's things like that
Was
just,
this
you
at
know,
the
they should.
Washington DC VA?
What was that?
Was this at the Washington DC VA?
No, she wasn't. I forget if she was in Florida or at the time I want to say Florida. That was just maddening, you know. I mean, when they did that, and it just showed, you know, it's like, are you kidding me? But you know, we've heard these are crazy things, and things, you know, like that just need to be brought to the attention. Like you said, it's so, sometimes you just think, well, I never thought of it, you know, but once you hear about it, you're like, that shouldn't happen. So we really need to, you know, and we've been fortunate for DAV. I must say, you know, we've just been really, really fortunate that we've always had great leadership in DAV in terms of from the organizational level, and women veterans is just, you know, without question always been a priority. So anything that we've wanted to do, you know, they've said, let's do it. That's great. And I think if you've come to convention, you've really seen, you know, we used to have maybe 25, 30 people come to our women veterans seminar, and I think we're up to over like 250, 300 now. So it just shows an interest, and both men and women. So that makes it even better, the support from all of DAV. Well, it's been our pleasure, and we, you know, love having the opportunity to talk directly with you guys. You know where we are. Al is a great leader there for benefits protection team and on legislative issues. I know anything we send out, he's immediately sending it to the network. And I hope you guys will be inspired, you know, from this meeting and thinking about other things that you can do now, you know, for the new year, and how you guys can, you know, just come up with maybe some new ideas others haven't thought about, and be an inspiration to other departments. And, you know, it's an opportunity. You can always reach out to another department and ask them, hey, do you have a Women Veterans Advisory Committee? You know, could I have the name of the chair? And then, you know, set up a Zoom call. I mean, you know, it's a way to meet someone else, ask them what they're doing, you know, how, you know, did they get the name of any woman veteran who's been hospitalized, so that you guys can make a, you know, send over a basket or send over some needs, things that they need, you know, a little kit or something. So, and even a card, you know, something simple, but yet might mean a lot to someone. So you guys, if any other questions come up, please just let us know. Ashley will send you out, you know, we'll send to Sandy and Al the PowerPoint, so you have that. And we look forward to working with you guys. And if any other questions come up, please just let us know.
Thank you, Joy.
Yep, and our email is at the end of the PowerPoint. So if you need us, you can just email directly. All right, everybody, you have a great evening and a great rest of your holiday weekend. Thanks so much, Sandy, for reaching out and set up. Thank you.
Take care, everybody.
Bye-bye.
All right, bye.
Thank you.
Bye now.
Bye-bye.